Person who are having the kidney deficiency, then you remember the person having the constipation as well, or the dysentery, diarrhea, sprue, or the IBS related problem as well. You remember lungs energy is good, that will strengthen to the renal system as well. When the lungs chi is not good, the descending downwards direction of the energy, then kidney is required to hold that energy. If the kidney is not enough holding properties for them, then definitely the renal system get impacted because of the pulmonary system is weak.
मस्त जोक मारा रे ये हंस रे हलकट हंस
Kidney system and receiving the chi from the lungs is very much essential. The key point, whenever there is a problem in the kidney energy, then you remember lungs also get impacted. Which is the organ clock timings? What is the organ clock time?
अबे जल्दी बोल, कल सुबह पनवेल निकलना है.
5 to 7. 6 o'clock is the peak time. Then 6 o'clock in the morning is large intestine time. Large intestine lungs also get affected. So therefore, when this will get impacted intestine, obviously that get impacted by the pulmonary system as well. How it is interconnected, you just see how amazing this information. Now receiving the chi from the lungs, I told you, whenever there is the cough and congestion is coming, because of not the related to the lungs are the reason to cause the problem, but the problem is related to the kidney system.
ओ भाई मारो मुझे मारो
Kidney is unable to receive the energy, could be the reason to cause the cough and congestion and asthma and breathing difficulties. Remember now, whenever the patient will get the cough and congestion, try to find out the place where exactly you have the problem is in the bones problem. Do you have the back pain? Do you have the cervical pain? Do you have any arthralgia? Try to recognize and then treat for the kidney system to regulate to the pulmonary system. But vice versa, when the lungs are good, then your kidney is also good. Your kidney is good, your pulmonary system also good. In that way, we need to recognize, we need to treat, and connecting point to be known as the 2 points will be the connecting point. One to be known as a chisa, the second point to be known as a folio, to connect each other. Number 1 is a leuphine. The second point to be known as a K7. Let me see today where the K7 point is located, and also govern the water which I told you, and also it stores the essence as well. What exactly store the essence? The semen and then ovum. The kidneys will going to store the essence, but very much essential. Whenever we required as a semen, sperm quality should be good, morphology also good, and also characteristics is good, motility is good, rapidness is good, liquefaction within 30 minutes is good. Then all these parameters, there is no azoospermia, there is no oligospermia, there is no tetrazospermia, and they have the abundant of the energy. That means you have the good sperm quality, but greater than 60 millions per ml you have the sperm's quality, then you remember you have the good essence of the kidney. But the people who do the masturbation,
मार साले का खोपड़ी तोड़
but at the age of 12 years, at the age of 13 years, at the age of 15, 16, 17, 20, 24 years, remember that causes the numerous problem to the after the marriage. But today you feel good. But obviously for the span of 1 minute it will take to do the masturbation, but you are spoiling the life. But the storage of the essence, that essence is a good quality. But you don't waste your essence during this particular situation. But menstruation happen at the age of 14 years, but before she will get the puberty. The men will enter the semen at the age of 16 years, but the boy will going to start the masturbation at the age of 12 years and 13 years. But the sperm is slowly entering, but before that he started wasting. Remember, this is the very, very hazards and also injuries to our life, and also eventually once you get the marriage, that will be really problem.
ये बड़ी अच्छी बात कही आप.
Even the police people who came to me, and then they told me that I do have the problem, and then I cross-checked their life. Then I recognized that they do have the problem. They do have the problem that have done the masturbation at the age of before the puberty or before the semen enters. Today, remember, because you are into the internet life, isn't it? But the whole world is in your hand. Google auntie is in your hand. Whatever you want, you can ask to them, and she will going to provide you. Then you are taking that knowledge, but you are utilizing. Obviously, the phone is very good today, but at the same time, how it is too good, in the too good level, that is the opposite level, that's too much bad as well, especially for the children. But please, 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 I recommend you, I suggest you, but doing the masturbation all the time is not good. But sometime it's required, perhaps yearly once you have done, but is no harmful, but you are doing repeatedly that every day. Even I could see that the children, but they do that, teenagers at the age of 12 to 15, 16, 20 years, but 3 times in a day they do the masturbation. Remember how quality will become the essence. What will be the future life of your wife? What about your future? How the parents are waiting for you to see the grandchildren, but you have no ability to produce the children. What stupid you made in your life.
50 बार बोल रहे हैं पढ़ने निकले वाले छात्रों को राजनीति से दूर रहना चाहिए हैं? अबे पढ़ाई लिखाई में ध्यान लगाओ, IAS बनो और देश.
That is a very, very big mistake sometimes we do. That's not really all the time is good. But the storage of the essence is nothing but semen you are storing, and also OVUM is storing by the girl. At the age of 24 years, protect that. Protect that. That is the life. That is the life. Parents has given you. You have grown up to the essence energy, the post essence energy, but that energy need to be strengthened in our life at the age of 8 years and the age of 7 years. What the lifespan is there, 7 to 14 to 21 years, or the 16 to 24 years, very much essential. Then the Mingmen is the gate of the life. Then that essence of the storage will going to store in one particular place, gate of vitality, that to be known as a right kidney, will going to store on one particular place, that to be known as a Mingmen. Mingmen is the brightness, Mingmen is the vital gate of the life. Where exactly is located? Just distal to the second lumbar vertebra, the point is located, that to be known as a Mai 4 point, that to be known as a Mingmen. I love this point. Such a beautiful point. Gate of the life. Vital force where exactly is existing on the spinal cord. Vises is the Manipura chakra. Swadhisthana chakra. Midway between this, the point is located, that to be known as a Mingmen. Mingmen acupuncture point also, the name is to be known as a Mingmen. But however, both the kidneys store the essence. That essence will going to be stored on one particular region, that to be known as a Mingmen. Where the gate of the life is existing on the back side. This particular region below the second lumbar vertebra, the point to be known as a DU. 4th point is located on this region. Such a beautiful point. So that is the gate of the life. It says the the left side kidney will be the proper kidney, but the right side kidney to be known as a Mingmen kidney. Left side kidney is the proper kidney, but which is left side of the kidney is connecting to the para orb of the uterus, and also seminal vesicle, and also there is the ejaculatory duct, and further it is the testicles. urethra. But whereas in right side of the kidneys, more predominantly will work on the essence. Right kidney is good, then your essence is good. Left side kidney is good, your urinal system is good. Urinal system is different, but the essence system is different. But essence quality is different, urine is different. Urine to be taken place by the left side of the kidney, but the essence to be taken place by the right side of the kidney. So therefore, the gate of the vitality, where it is existing? On the Mingmen. Where it is located? Second lumbar vertebra, the point is located. You remember, whenever there is a problem in the renal system, whenever there is a problem in the renal system, connect to the 3 points. One to be known as a Mingmen, that is the GB25. Then second point to be known as a Mingmen. 2 points, then center 1 point. Connect to treat for the kidney. No doubt the Shenchu Sishi. Shenchu, that means is the UB23, and then is the Sishi, ZHI, ZHIZ, She SHI. Sishi is UB51. UB51 point, and also there is a UB23, and then Mingmen, the GB4, and further GB25. These are the points which the kidneys are located. Add up the another point to be known as a, that is the point to be known as a stomach 21 point. So that is also Chungmen, Liangmen, Kwanmen, Horomen, Tianshu. Stomach 21 point. You connect that, then that passing the renal artery to the kidneys. Kitna pyara sundar formulas hai. We can make it as a creatinine, and also some other conditions will become the strong. हम लोग मेंटेन कर सकते हैं, क्यूर करना. No, totally the renal parenchyma cannot be totally reversible, but nephrons cannot be totally reversible, but still the survival can be taken place by using this particular concept. Definitely that's called as a Mingmen. Again you keep it in the mind forever. Whenever at the age of 60, 70, 80 years the man comes for the treatment, remember the first point need to be activated. People says, I do have the diabetes mellitus, I don't have the energy. Now I am 50 years old, but I have the diabetes for the last 1 decade, but still I feel low energy. The wife says, but my husband doesn't have the good energy. The energy he feel very weak. Then indicating, remember, the husband don't say in front of the wife to the practitioner. At the same time, wife says that my husband, he always feel low energy. So he have the weakness. The word weakness comes, then you remember the sexual weakness is there with the husband. They need to be activated. That to be known as a, come on. Mingmen, yaar bolo na.
अबे जल्दी बोल, कल सुबह पनवेल निकलना है.
Are you tell no? Yes, DU4 is required. GV4 is required to activate. But that's really important. Then how's the willpower as well? So, no, nothing problem. One kidney also have the more stamina and is strong, but that can. Yeah, that is as per the Chinese medicine, but as per the modern medicine, but that can be survival to be taken place. Now the gallbladder is not there, but still the overload by the liver. But liver is taking care for the both the functions. Likewise, the kidney also works, independent as well. How's of the willpower? What is willpower? Ayyo, I feel low energy, no hopes in my life, but always say I am very, very negative thinking person. I don't have the, willpower in my life. But I cannot do much, I cannot talk, but the words are not coming. Something like that, the patient feel inferiority, complex all the time. What is required? Willpower is required, wisdom is required, knowledge is required. That to be empowered by the? Yeah, come on. Then produce the marrow, fill up the brain, and strong as the bone system. Itna sundar hai. प्यार तो करते हैं ना? कैसे? सब्जेक्ट को प्यार करो ना. Produce
खत्म. बाय बाय, टाटा.
the marrow, fill up the brine. क्या है? Produce the marrow. Marrow to be known as a two types. One to be known as a bone marrow. The second to be known as a sea of the marrow. Isn't it? एक बोन मैरो को भी रेगुलेट करता है, ब्रेन को भी एक्टिवेट करता है. वन टू बी नोन एज ए, डू यू नो देयर इज ए बोन सिस्टम. ऑल द बोन्स डजंट हैव द मैरो. वेरी फ्यू बोन्स we have the marrow. So that to be known as a, you look at about the bone and you look at about the periosteum is the outer covering layer. Then you just cut it, that do the intersection. Then you will get the medulla. Inside the medulla there is a cavity, that medullary cavity. In that cavity what is existing? I love this. That to be known as a marrow. कितने लोग ले दिया तो बस आज गुद खाना है. People says that, isn't it? But it is so delicious. Entire in the meat, which is the tastiest one. Bone marrow is the tastiest one, isn't it? Such a wonderful. But that will produce by the kidney system. That's the reason it produces the bone marrow. So inside the bone marrow, there are the two types of the marrow again. One to be known as a yellow marrow. The second to be known as a red marrow. Then take the red meat, it will become red marrow. Then you take the goat and you will become the yellow marrow, isn't it? Nothing like that. Oh, sorry, I don't know. Okay. Right, there are the two types of the marrow. Red marrow, which is required for the leukocytes, which is required for the thrombocytes, which is required for the RBCs as well. The yellow bone marrow produces the stem cells. Stem cells are required, that to be known as a raw cells. That to be known as a immature cells will become the mature. Isn't it? Where is the leukopenia? Leukopenia is kind of the blood cancer. Right? Where the bone marrow extraction to be taken place on the vertebra. Below the second two. Mingmen is there. Below the Mingmen. Below the Mingmen, what is existing? Bone marrow is existing. There they will screws and then take up the bone marrow. Then they will going to send for the laboratory. I mean to say that the produces the marrow. That means the entire the bone system inside the bone, that in order to understand the cells quality having any cancerous of the cells, but they will going to see under the bone marrow test. But however, it is very, very painful situation when we wanted to do the malignancy diagnosis, but I don't recommend all of them to do that, but it's really a painful situation. But it produces the marrow, that means the red bone, red marrow, yellow marrow. Whenever there is the kidneys having the ability to produce the red blood corpuscles, where the erythropoietin and also renin will going to release, through that the red bone marrow will going to produce. No doubt the white blood corpuscles and also platelets called as the thrombocytes, leukocytes, all will going to develop through this bone marrow system. When the hemoglobin is very poor, the iron is very poor, the ferritin is poor, then need to be strengthened by activating to the kidney system. So therefore it is very much essential to regulate to the bone marrow. But at the same time the sea of the marrow, that to be known as a sea of the marrow, to be known as a brain and then spinal cord. So which is what is existing inside the brain and spinal cord? CSF is existing, that to be known as the sea of the marrow, cerebrospinal fluid. But the fluid is giving the nutrition supplement to the brain system and also spinal cord. If it is good quality of this CSF, how many ml of the CSF? Each ventricles of the brain, especially on the ventricles of the brain, around 25 ml of the 25 ml of the CSF is existing inside the brain. At the same time, subarachnoid space and dura matter, arachnoid matter, pia matter. But now in between these two, arachnoid and then pia matter, there is arachnoid space is there. In that space what is existing, that to be known as a CSF. Inside that CSF having the colorless liquid, also having a lot of nutrition. Water, calcium, magnesium, phosphorus, many things are existing. But that giving the nutrition, and also friction not to be taken place by the external injury cannot be taken place to the brain. In that way, that have the protective mechanism, and also nutrition supplement to the brain and also spinal cord. Maximum nearly 125 ml of the CSF is existing in the brain and then spinal cord. But however, on the ventricles of the brain, 25 ml of the CSF is existing in the brain system. But altogether collectively 150 ml of the cerebrospinal fluid is existing. How the semen? Normally we can consider as a semen. Semen is nearly 2 to 3, 4 ml will come out in each ejaculation. Likewise, that also one kind of the CSF, that also one kind of the essence, but CSF also one kind of the essence. So that essence is very much essential. Whenever there is a brain deformity, the children will come for the poor malnutrition or the Down syndrome or maybe the delayed milestone or cerebral palsy child, aphasia, apraxia, dyspraxia, speech related difficulties. That time we need to be activate. 2 points I remember. One to be known as a Yung Chuan, second to be known as a Tai Si. One is the K1, the second point to be known as a K3. Kitna amazing hai ye. It enhances the energy of the C of the marrow. C of the marrow to be taken place. So by using the kidney system as well.